Why some patients don't recover even after the right treatment. There's a pattern across chronic Lyme, cancer recovery, and addiction. Patients go through treatment, and yet they don't fully come back. Not cognitively, not physically, not as themselves. Different diagnoses, but the same aftermath: brain fog, fatigue, inflammation, loss of clarity, motivation, identity. Lyme patients deactivate the infection, but not the symptoms. Cancer patients finish treatment, but don't regain vitality. Addiction patients detox, but relapse, or never feel normal again. And medicine calls this post-treatment.
Hello, I am Dr. K. Paul Stoller, and many of you know I have webinars on these ailments at K. ENNETHSTOLLERMD.com, because we have been using, or should I say conventional medicine has been using the wrong model. Well, the wrong model for us, but the right model for them, because there is no profit in the cure.
There's a common denominator between cancer, Lyme, and addictions. Oxygen delivery is impaired, tissue remains damaged. The brain is metabolically compromised. One can remove the root cause, and hyperbaric oxygen can greatly assist with that. Restoring the environment is where a different approach emerges. Hyperbaric oxygen therapy, not targeting one disease, but changing the conditions the body operates in. 100% oxygen, under pressure, driving oxygen deeper into brain tissue, damaged cells, ischemic areas. In Lyme or borreliosis, it directly kills the bacteria because it can't tolerate oxygen while supporting neurological recovery. In cancer, it restores health to the mitochondria, which become well enough to realize they are in a cancer cell and dispatch that cell, a process called apoptosis. It also supports the healing post-radiotherapy and chemotherapy. In addiction, it will restore brain function to those suffering from chemobrain. Different diseases, same underlying leverage point, cellular recovery. Across clinical trials, hyperbaric therapy has shown improvements in neurological function, chronic pain, post-concussion symptoms, radiation injury, and most importantly, quality of life, not just survival, not just symptom control, function.
Why are we trying to fix complex recovery without restoring the system first? Painting over rust never pans out. Now, this therapy is not for everyone. Timing matters. Protocols matter. Patient selection matters. Used incorrectly, it's just another tool. Used correctly, it can change trajectories. My webinars break this down. Which patients benefit most, where it fits in Lyme, cancer, and addiction recovery, and how to use it strategically, not blindly. If recovery has stalled, this is where you start asking better questions. To learn more, go to KENNETHSTOLLERMD.com. Share the video with someone who might need this information.